some of my time. It's a 40-minute presentation, but I'm sure I will finish in 30 minutes or even less than that. The topic is enhancing preparedness, climate change crisis, mental health, ecology and ethics. I also bring you the goodwill from the World Psychiatric section on psychiatry law and ethics, and also from the World Federation for Mental Health for this meeting. Quote, climate change is the single greatest threat to a sustainable future, but at the same time, addressing the climate change presents a golden opportunity to promote prosperity, security, and a brighter future for all. This is from Ban Ki-moon, former Secretary General of the UN. Introduction, climate change affects us all in every part of the world and is one of the greatest challenges before us. Scientific community has an obligation to bring to focus the adverse consequences of climate change on the mankind and the planet we live in. There is no exception here. Undoubtedly, climate change and environment changes are posing a fundamental threat to human life and livelihood, wildlife, and nature. These changes are also impacting mental health of the world inhabitants in various ways. Climate change is not just an environmental issue, but also a health issue. The potential health effects of climate change are immense. Climate change and its rapid emergence in the past decades are a major challenge to public health, together with poverty, inequity, and infectious and non-communicable diseases. Major threats to global health from climate change through changing patterns of disease, water and food insecurity, vulnerable shelter and human settlements, extreme climate events, and population growth and migration. Climate change is expected to impact mental health via a range of direct and indirect pathways. Direct pathways include exposure to traumatic events such as bushfires and other severe weather-related events. Indirect pathways largely operate through a range of social, political, and economic determinants of mental health, such as poverty, unemployment, and housing. Vulnerable people and places, especially in low-income countries, are anticipated to be particularly badly impacted. Proactive preparedness in the face of climate change is vital for safeguarding our planet, economies, and communities, and ensuring a sustainable future and health for all. Climate anxiety. Climate anxiety, as defined by the American Psychological Association, encompasses, quote, a chronic fear of environmental doom, unquote, which can range from mild levels of stress to clinical disorders such as post-traumatic stress disorder, depression, anxiety, and even suicide. Maladaptive handling strategies such as substance misuse and partner violence have also been associated with climate anxiety. Climate anxiety is typically seen as an adaptive response to the challenges posed by climate change. Projected climate change and its outcome. In near future, heat waves and extremely high temperatures are anticipated to become more frequent and intense. Representative Conservation Pathways, RCP, 8.5 ensemble indicate variation in projected annual mean temperature. In South Asia, the mean annual temperature is expected to rise in 2040-59 between 1.41 degrees centigrade in Sri Lanka and Maldives to 2.51 degrees centigrade in Southeast Asia. Heat waves are expected to become commonplace by 2050, particularly in South Asia, with major health and economic implications. Annual precipitation in South Asia will increase between 12.36 millimeters in Pakistan, 180.3 millimeters in Maldives, except for Afghanistan, where a minus degree is estimated around 2040-59. Climate change and its impacts. Climate change refers to significant alterations in global temperatures and weather patterns over time. While climate change is a natural phenomenon, human activities, particularly the burning of fossil fuels, deforestation, and industrial processes have accelerated its pace. It can significantly disrupt existing ecosystem. Key impacts of climate change: rising temperatures, melting ice and rising sea levels, extreme weather events, ecosystem disruption. Many species are struggling to adapt to changing climates, leading to shifts in biodiversity. Some may face extinction, while others may thrive, altering existing ecosystems. Impact on agriculture, water scarcity. Altered rainfall patterns can lead to droughts in some areas and flooding in others, stressing water resources and affecting availability for drinking and agriculture. Human health risk. Increased temperatures and pollution can exacerbate respiratory and cardiovascular issues. Heat-related illnesses and the spread of vector-borne disease are also growing concerns. Economic consequences, social and political issues. Climate change and mental health, this is a pictorial representation how it can lead to PTSD, depression, suicide, reduced well-being, stress, climate anxiety, and the others. Mental health impacts. Climate change is negatively affecting the mental health and emotional well-being of people around the world. It can be divided into direct and indirect effects. Climate change can act as a stressor. Ways climate change can affect mental well-being include eco-anxiety. So already I have mentioned about that. Trauma from extreme weather events, natural disasters, displacement, impact on vulnerable populations, social inequities, access to resources, disruption of community and social networks, community cohesion, loss of cultural identity, changes in lifestyle and habits, food insecurity. Climate change can affect food supply and access, leading to anxiety about food availability and nutritional health. Economic stress, job losses in climate-sensitive industries can result in financial stress, impacting overall mental health. Chronic stress, mental health services demand. So this is a very recent picture from our state in Kerala. There was a huge landslide. About 600 people were buried. And, some of the bodies were obtained from a river about 3 or 4 kilometers away. So this is a sudden, these are all happening. This is not exclusive to our state. It is happening in all parts of the world. So the loss of life and the loss of property and the impact on the environment are serious concerns, should be serious concern for us. Coping strategies, community engagement, mental health support, mindfulness and resilience training, ecological considerations, biodiversity loss, shifts in ecosystem distribution, altered species, changes in phenology, altered seasonal cycles can affect migration patterns, breeding seasons and flowering times, disrupting ecological synchrony. Changes in plant blooming times may misalign with pollinator availability, impacting food production and ecosystem health. Ocean changes, increased carbon dioxide levels lead to ocean acidification, harming marine life, particularly coral reefs and shellfish. Temperature rise can lead to coral bleaching and shifts in marine species distribution. Soil and water changes, increased rainfall variability and extreme weather can lead to soil erosion and nutrient loss, impacting plant health and agricultural productivity. Altered precipitation patterns can stress freshwater ecosystems, affecting aquatic species and water availability for humans. Carbon cycling and feedback loops, ecosystem services disruption. I am cutting short because of lack of time. Some of the ethical considerations. So intergenerational justice, responsibility to future generations. We have a responsibility to our future generation. None of us can forget that. There's a duty to minimize harm and ensure a livable planet for those yet to be born. Distributive justice, fairness to burden and benefit. The impact of climate change are not evenly distributed. Ethical considerations include how to equitably share the burden of climate adaptability and mitigation. Global inequality. Ethical frameworks call for wealthier nations to provide support and technology to help poorer countries address climate change. This is unfortunately not happening now. Rights of nature, ethical considerations about recognizing the rights of ecosystems and species, advocating for their protection beyond human utility. Indigenous rights, participation and voice, moral responsibility of corporations. Companies contribute significantly to carbon emissions. There are ethical implications regarding their responsibility to reduce emissions and invest in sustainable practices. Technological solutions and geoengineering. The development of geoengineering technologies raises ethical concerns regarding potential risks, unintended consequences, and moral hazard. The idea that reliance on technology may reduce the urgency of reducing emissions. Mental health and well-being. Psychological impacts of climate change, such as eco-anxiety, highlight the ethical responsibility to address mental health in climate discussions. ensuring that individuals and communities are supported. Adaptation versus mitigation. Now integrating mental health, ecology, and ethics. So holistic understanding of climate impact, ethical framework for action, community engagement and empowerment, mental health support in climate policy, promoting ecological literacy, education and awareness, research and collaboration, sustainable practices. By weaving together mental health, ecology, and ethics, we can create a more comprehensive and effective approach to tackling climate change. Enhancing preparedness, risk assessment and planning, infrastructure resilience, building codes and standards, update building codes to ensure new constructions can withstand extreme weather events, retrofit existing structures to improve resilience, green infrastructure, invest in nature-based solutions such as green roofs, permeable pavements, and urban forests to manage stormwater and reduce urban heat. Some of these things can be easily done and needs to be done. And unfortunately, these are not being considered at all. Community engagement and education, emergency response planning, investment in research and data, sustainable resource management, water management, implement strategies for sustainable water use and management, including rainwater harvesting and water recycling to cope with changing precipitation patterns. Agricultural adaptation, encourage practices that improve agricultural resilience, such as crop diversification, agroforestry, and soil health management. Financial and technical support, health and well-being considerations, policy and governance, monitoring and evaluation. Call to action, what can individuals do? Combating climate change can feel overwhelming, but individuals can make a significant impact through everyday actions. Here are some practical steps you can take, concerns all of us. Reduce energy use, use your car less often, use of public transport, minimize waste, don't waste your food, go for more plant-based food rather than the animal-based food, sustainable transportation, mindful consumption, don't consume. Obesity is threatening the world now, as we all know. Water conservation, educate and advocate, support renewable energy like electrical, which is solar, is one of the, for example, we have in Cochin Airport in Kerala, the world's first fully operated solar airport. And it's wonderful. It has been rewarded by the United Nations agencies. So these are some of the things which we can incorporate in all parts of the world. Plant trees and green spaces. Mind your carbon footprint, spread the word. Every small action adds up. By integrating these practices into your daily life, we can contribute to a healthier planet. Role of organizations, NGOs, governments, all of us. The Global Psychiatric Association, the World Federation for Mental Health, the World Psychiatric Association, everyone has a duty. Advocacy and awareness, research and innovation, community engagement, funding and resources, monitoring and accountability, policy development, infrastructure and investment, incentives and subsidies, international cooperation, disaster preparedness and resilience, public awareness campaign. Of course, I can talk for an hour on each of them, but I think the time constraints are before us. Some of the challenges and barriers, lack of awareness and education, resource constraints. Governments have no money for environment. They have money for everything else. They have money to buy cars, buy to aeroplanes, buy helicopters, but they don't have money for our environment. Political institution challenges, economic barriers, data gaps and uncertainty, social and cultural factors, technological limitations, coordination, collaborative issues, advocacy issues. Of course, we have to be green conscious. We have to take people who are along with us, and it's not very easy because we have to fight mafias and vested interests in this in our efforts. The task before us, enhancing preparedness for climate change crisis, is vital as it intersects with mental health, ecology, and ethics. The psychological impacts of climate change, including anxiety and trauma, underscore the need for comprehensive mental health support in vulnerable communities. Ecological resilience is essential, requiring proactive measures to protect biodiversity and ecosystems that underpin human well-being. Ethical considerations must guide our actions, ensuring that marginalized populations are prioritized and their voices are heard in climate discussions. Collaborative efforts among governments, NGOs, and communities can foster holistic strategies that integrate mental health and environmental sustainability. Education and awareness are crucial to empower individuals to take meaningful action while addressing their psychological needs. By promoting equitable access to resources and support, we can enhance community resilience against the impacts of climate change. Ultimately, our approach must reflect a commitment to both ecological integrity and social justice. Strengthening preparedness is not just a necessity, but a moral imperative for future generations. Together, we can build a more sustainable and compassionate world in the face of this global challenge. In conclusion, when the focus of the world is shifting to sustainable living, there is definitely a need for people, and particularly the mental health professionals, to be mindful of climate change and its growing consequences. The climate change crisis poses significant risk to the well-being of individuals and communities in this region. Climate change has a noticeable impact on mental health, including conditions such as climate anxiety and related disorders. This is a pressing concern that must be addressed. Through determined efforts and shared commitment to climate action, we can pave the way for expressive progress in mitigating the impacts of climate change. Given the transboundary nature of climate change, collaboration with international organizations, research institutions, and donor agencies is vital. Access to funding, technical expertise, and knowledge exchange can support the region in implementing the effective climate adaptation and mitigation measures. Looking toward the future, it is imperative to recognize the urgency of addressing climate change at a global scale, possibly through adapting a holistic and collaborative approach and eventually striving towards a sustainable and resilient future, safeguarding both the environment and the well-being of its inhabitants. As the father of India, our nation in India, Mahatma Gandhi has said, "Earth provides enough to satisfy every man's need, but not every man's greed." My thanks are due to the members of the WPA section on Psychiatry, Law and Ethics for their valuable inputs. Our PG resident, Dr. Dina Anna Jacob, who has helped me in research and for the preparation of this PowerPoint. Thank you very much for the patient hearing.
Yeah, thanks a lot, Professor Kallivayalil. I think it's a great talk, and I think there's so much to do. So are there any questions, or if not, is there any questions from the audience? We're very welcome. If I can say, would we have to change a social system in the world, so are nations the right actors in this, or would we have to change the social system or the society system in general, or the national systems in general, for achieving what we need to achieve?
No, we know that the politicians, they always go for political vote banks, and the environmental people who are ecological conscious are fewer. For example, people think, what is harm if we destroy the forest, or what is the harm if we destroy the rocks to build roads, or if we are consuming fossil fuels because they are cheap. So we have to educate the people about the anxiety. Even very recently, I just returned from Rome, where one of the discussions was some of the delegates came up and said, we have stopped eating meat. Then they also explained that the animal, for example, beef, the animals, because they chew the gut, it has been proved by scientific evidence that they emit a lot of methane, and this is very much harmful to the environment. So these are some of the ways in which we can educate the people, and once the people are there for environment, I think government will have to act. We will have people who listen to us, and I think the associations like Global Psychiatric Association should be in the forefront, along with all other organizations, not only medical organizations, but all people who are committed to humanity. Thank you.
Dr. Joy, you wanted to make a comment or a question?
Yeah, just I would like to add one point. The keyword in this aspect is sustainable development and growth. Sustainable development and growth. That is very, very important. So you can cut a tree, but when you cut a tree, you have to think of your predecessors or successors, and you have to plant 3 trees. That is sustainable. And also another thing is reformation. That means we have to reform, and we have to change the outdated technology and methodology. Another thing which I'm asking is, can we get these slides?
These slides. These slides are part of a ongoing publication. So once the paper is published, I'll be able to share it.
All right, thank you.
This paper is a part of a chapter in a book which is going to be published, forthcoming book.
But you don't mind that we publish this, or this video will be shown up?
Once I have to get the permission of the editor. So by the time, then we will do that.
Okay, so okay, that's fine. Any other questions?
I thank the comments. Thank you for the comments from the Dr. Joy, and I fully agree with them. And of course, we know that the United Nations focuses itself on sustainable development goals, where environment is one of the major goals. And now, mostly what happens is we have the Millennium Development Goals, and most of them remain on paper. So we have to really engage people, and that's our duty. And 2030 with the Sustainable Development Goals have to be achieved. So we have to work together for that. Thank you.
Can I ask about one, maybe time is a question. We're back in time, so I can ask the question: do you have enough time to prevent the worst of the global crisis of the climate, or is it already too late, partially?
I think it is too late. I am told, while we had a discussion on climate change. One of the discussions in Rome was that people are saying Europe has experienced floods as never before for the last several decades. So this is happening everywhere. And if we are not now taking these danger signals, when are we going to do that? So that's a very serious question before us. I think we are already too late, but if we act now, we can at least produce the catastrophic effects of climate change.
Okay. Thanks so much for this talk, and